Welcome back. I'm Brian Ario with the Outpatient Recovery Program at Applied Care Services, and I'm the treatment director there. Today, we're going to talk about the criteria for substance use disorder, and we're going to be using this, the Diagnostic Statistical Manual 5th edition, which is what we use in order to diagnose mental health and substance use disorders. And especially, it really helps us to statistically find, hey, you may have this disorder, or your disorder fits in this criteria. So we're going to go right out of this book, and I'm going to go over the criteria for substance use disorder. So yeah, I'm going to be reading out of the book. Oh, and by the way, this is not meant to, don't use this to diagnose yourself. And this is not meant to be a blanket statement of saying like, well, if you have these things, I am not diagnosing anybody. This is just educational, so you understand where we formulate, where do we take the information that you give us in a diagnostic assessment in order to see what disorder you may have. So remember, this is not to be used as a diagnostic thing or anything else like that. I'm just giving you the criteria so you're better aware of what we're going off of, where we make our informational choices, where do we gather our information from the client in order to give an accurate and proper diagnosis. So let's get into this. So it really goes down to a problematic pattern of use leading to significantly impairment or distress as manifested by two of the following things occurring within a 12-month period. 1, the substance is often taken in larger amounts over a longer period that was intended. So we're taking more than what we intended to take over a longer period of time. There's a persistent desire or unsuccessful efforts to cut down or control the use. So like, I can't cut down, or I have to use. I can't stop. I just must do something. I must use. Number 3, a great deal of time is spent in activities necessary to obtain the substance or to recover from its effects. So it might take longer. I think of alcoholics, right? Where they wake up in the morning and they have to take a shot right away, or it might take them a few days of feeling better and before they can function again. Number 4, craving or a strong desire or an urge to use. So when we talk about that craving, if you think of like, for me, it's like cheeseburgers. I think of a cheeseburger and then I crave it. I'm thinking about cheeseburgers all day long. Same thing, the strong desire or craving or urge to use. Number 5, recurrent substance use resulting in the failure of major role or obligations at work, home, or school. So that means it's getting in the way of what you would normally do. It gets in the way of our work, our productivity at work, our relationships. Were we seeking this over our relationship, or it's causing strife within a relationship? Then that's a problem, right? Number 6, continued use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of the substance. So even though we realize that it's happening and that it's causing a problem, we do it anyways. It doesn't make a lot of sense, but this is where we live. Important social, occupational, recreational activities are given up or reduced because of the use of the substance. So instead of going and bowling or playing golf or tennis or whatever you like to do, you choose the substance over that. That would be an impact in our lives. Number 8, recurrent use in situations which are physically hazardous. So you think about, hey, you may get drunk or you may get high and then climb a ladder and go work on your house. That would be physically hazardous. Or the number one is driving while intoxicated, or doing something that could cause injury to yourself or to others while you're under the influence. That would be not a good thing. Number 9, the use is continued despite knowledge of having persistent or recurrent physical, psychological problems that is likely to have been caused or exacerbated by the use of the substance. So if I have a psychological issue, such as depression, or a physiological issue like high blood pressure, heart disease, diabetes, and I continue to use even though it causes more problems than what it solves or what I think it might solve, then we have a problem. Number 10, tolerance is defined by either of the following: a marked need or increase in amounts of the substance to increase intoxication or to achieve the desired effect. B, a marked diminished effect with continued use of the same amount of the substance. So either I have to use more in order to feel something, or I use it and I don't feel anything. I use the same amount and it doesn't do anything. Number 11, and this is where some of the substances get real dangerous. So withdrawal is manifested by either of the following. So withdrawal syndrome, and especially if we look at alcohol, we look at the sweating, the shakes, sometimes what they call DTs, hallucinations, and even seizures. Those are more of the extreme forms of that, and that can occur within 12 to 24 hours after we've not drank, especially if we're a high use of drinking. And B, such as we may use a substance early in the morning to push off the withdrawal symptoms. So if you think of use alcohol as an example, if I wake up in the morning and I'm really shaky and I can't really do much, and I take that drink in the morning and then my nerves calm down, that would be a part of using in order to stave off the withdrawal symptoms. So we look at all these different criteria, and if we meet several of these criteria, then that leads us into the diagnosis of the substance use disorder. The amount of the criteria that are met by the individual would determine the severity level of their disorder. So 2 to 3 would be mild, 3 or more would be moderate, and more than 6 would be severe type. So hopefully this will educate you a little bit more on, we just don't, pick it out of the sky and go, well, we think it's this, we think it's that. But we actually use a manual that has been developed over many, many years and statistically proven that people that meet these criteria may have these disorders, and which helps inform us on how to treat and where to go in the direction that the client might need. If you or a family member meet these criteria, remember, we're not diagnosing, but if you think that you meet more than 2 or 3 of the criteria in here and you feel like you might have a problem, or you know someone that has a problem, give us a call. And if you don't want to give us a call, call someone. Seek out help, because it's not going to get better. It's only going to get worse. This has been Brian Ariel with the Outpatient Recovery Program at Applied Care Services. Have a good day.